This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
According to information obtained by the Centers for Disease Control, nearly 3 million people worldwide die each year as a result of obesity and the conditions it causes.
The CDC reports that despite a government goal of lowering the prevalence of obesity to 15% by 2010, there was a dramatic increase since 1990. And in fact, in 2010, 12 states have a rate of over 30% obesity. Now, as of right now, there is no state with an obesity prevalence under 20%.
And here's how that breaks down for us here on Delmarva. In Delaware, almost 27% of us are obese. Just over 27% in Maryland are obese, and Virginia is only slightly behind Maryland. And since we're all concerned about medical costs now, the average cost for obese people is over $1,400 higher annually than those considered normal in weight.
Pretty scary numbers. So what can we do about it? Well, joining us this afternoon to explain some surgical options that might be available to you is bariatric surgeon Dr. Tariq Waked from Peninsula Regional Medical Center. Thank you so much.
Thank you for having me here.
For joining us this afternoon. Let's start from the very beginning. What is bariatric surgery?
Bariatric surgery is basically surgery that modifies the stomach and the digestive system in order to reroute the food to cause restriction and malabsorption.
So why do you think we are where we are with the obesity numbers so bad right now?
Yeah, I think it's a combination of psychosocial factors. We live in a very stressful environment, and most of the food that are accessible to us is basically fast food.
Right.
And the combination of that and our bad eating habits results in morbid obesity.
All right, so there are various procedures that you do, correct?
Correct. We currently offer 4 procedures at the Peninsula Regional Medical Center. The first one is an adjustable band. The second one is a laparoscopic sleeve gastrectomy, a gastric bypass, and recently we brought this, it's called a duodenal switch, which is performed in very few centers in the United States.
All right, well, let's start with the gastric band. Tell me about that. How does that work?
Gastric band is basically a elastic band, just like the name implies, that will wrap around the upper part of the stomach in order to create a smaller pouch and provide restriction on the food, on the portion size of your food. So instead of eating the whole meal, now you're going to be eating approximately 10 to 15% of your meal.
Okay, so that makes sense, but are there complications that come with that?
There are, and the major complication is weight regain. Other complications may include band erosions, band slippage, where the band might slip up and down, and band infection, where the band gets infected and then it needs to be removed.
Wow.
Right. So the other one you talk about is the sleeve gastrectomy?
Sleeve gastrectomy, this is a recent operation that's been being performed for the past 6 to 7 years, and it's basically making a banana-shaped stomach. And by reducing 90% of your stomach and obviously leaving you with 10%. The way it works is also by restriction. So it restricts the portion size of your food. The other thing is the part of the stomach that we remove has a lot of cells that send signals to your brain to cause hunger. And by removing that, it will lead to appetite suppression.
Ah, okay, but again, the side effect or complication question.
Side effects, like any other operation, includes a gastric leak, where we staple the stomach, the gastric content might leak to the outside, and that's really low, or gastric narrowing, which is also less than 2%.
Okay.
All right, and you actually have some tools here. What do you use this for?
I'm going to have Jimmy hold this for me.
Okay.
This is basically a stomach made of foam, and this is the surgical device that we use to staple and cut the stomach and make a sleeve out of it. I'm going to put this device here, and by firing it, it basically cuts the stomach and staples it.
Now, when you say laparoscopically, you're not actually opening up the entire abdomen to do this.
No, it's basically a new procedure that started 15 to 20 years ago, and it's a major advancement in the era of bariatric surgery. And the reason is we can make the procedure in with small incisions, less than 1 inch, instead of making the huge incision in the midline, and results in faster recovery, less pain, and much less complications compared to the traditional open incision.
So this part right here is actually coming out.
This part is coming out, and this is the part that I said has all the cells that stimulate hunger.
Right.
And as you can see here,
So then effectively it sort of goes like
it's
that.
going to end exactly. And when we talk about gastric leak, it means that sometimes juice might leak outside of this staple line, but the likelihood of that happening is less than 1%.
Very sad. Okay, so there's one that we hear a lot about, and that is the laparoscopic gastric bypass. Tell us about that.
This is the gold standard of bariatric operations, and we basically compare the rest of the bariatric operations to the gastric bypass. And the reason is it's the longest operation that has been really efficient at losing weight so far. And basically we do a small patch of the stomach,
Right.
and then we reroute some of your intestines so that you don't digest most of the food. So now when you eat, you're going to get a restriction, just like the sleeve or a adjustable band. And at the same time, if the food goes past through that restriction, then you're going to malabsorb most of it.
Now there are some side effects and complications to this one as well.
Correct. There's a leakage at the connection of the intestine to the stomach, and that also happens less than 1% of the time. You might have a gastric ulcer, especially in those patients that smoke, or you might get dumping syndrome, which happens whenever you eat a high-carb diet or a diet that is high in sugar.
Right.
Will lead to abdominal pain, and nausea and diarrhea.
Gotcha. Now there is a new one, the fourth one you said, but this is a new procedure that you've got.
Now, this procedure has been being performed for the past 25, 30 years.
Oh,
But it's
okay.
been all done through the open incision. Not many institutions do it laparoscopically because
Right.
it's the most complex operation in bariatric surgery.
And that's the duo.
So do-
And that's the laparoscopic duodenal
Okay.
switch.
Okay.
It's also the most effective for weight loss. But like any other operation, the more complex it is, the higher the complication rate.
Which we have right there, some of
Correct.
those complications, the leakage and gastric narrowing.
Like you said, leakage, gastric narrowing from the sleeve, diarrhea, if you eat, if your diet is rich in fat.
Right.
At an average of 3 to 5 bowel movements each day, and malnutrition.
So there's a commitment to this. Okay, so big picture of everything you've just explained to us here. Can any patient qualify for the surgery?
There are some requirements. The BMI, the patient should have a BMI above 35 with some obesity-related diseases,
Okay.
or a BMI above 40. Now, BMI stands for Body Mass Index,
Right.
which is basically a fancy formula that calculates your weight by taking into account your height. And so a 6'2" man that is 200 pounds doesn't have the same BMI as a 5'3" man with 200 pounds.
So one would qualify, the other one
Exactly.
would not.
And this is not a magic bullet, is it? This is
It's not.
the end all be all.
And I strongly tell this to my patient that this is not the magic bullet. This is going to be a big push to lose weight, but it's a minor component of the whole equation. And the way I think about it is the most important thing is the lifestyle modification.
Right.
That's
We
the
need to
big thing.
change their eating habits. We have to make sure that they exercise.
Doctor, thank you so much
Thank
for
you.
sharing this very important information. Now, if you'd like to know more about bariatric surgery in Peninsula Regional Medical Center, you can visit our website at delmarvalife.com and click on the show tab. Alrighty, so when it comes to getting healthy, the earlier we start, the better off we are. And they say milk does a body good, but there's more that you're going to want your kids to do. Up next, we find out what they can do for a lifetime of healthy bones.
And Jimmy and I get up and get our old bones moving. From hopscotch to jump rope, there are good reasons to make exercise a family activity. Trust me, you don't want to miss this.
No, you really don't. Maybe you just need to eat better. Dr. Oz tells us how we can eat healthy on a budget.
Here's some quick ways to eat healthy on a budget. Shop high and low on grocery store shelves. Manufacturers pay to place their products at eye level, and less expensive versions of the same items can often be found on upper or lower shelves. Next, stick to the outer aisles of the supermarket to find the widest selection of unprocessed foods, which are usually less expensive and healthier for you. Beans and other legumes are an excellent source of protein and will create a cheap and easy way for you to eat healthy meals. Buy your beans in bulk and you can save hundreds of dollars a year. Frozen, canned, and dried fruits and vegetables tend to be less expensive and will last longer than fresh versions. And they're usually just as nutritious. And consider growing some of your own produce.